Hi, I'm Dr. Virginia von Schaefer, and today I'd like to present a little bit of information about basically how to go about obtaining a good preliminary evaluation if you do have cancer. I think this is very important because time and again I'm seeing patients who come to me and have been told they have cancer. Maybe it's a biopsy or maybe it isn't. Um, could be an imaging study. And they're recommended to have full dose chemotherapy and radiation therapy and a lot of other treatments without full knowledge of exactly what the problem is and how extensive it is. Now, I've had the experience many times of examining patients, finding a tumor, and being concerned about making sure there isn't tumor mass somewhere else, okay, in the body. And when we do a PET-CT scan, we find out that, lo and behold, not only is there a cancer lesion that's actively metabolizing in the breast, but there are also metastases in the liver or sometimes in the bone. All this information is very important if you want to have proper planning and create a good strategy for adequately treating all of the problem areas in your body. So first, I'd like to start with a good basic set of lab tests that can be done through LabCorp or Quest and are covered by insurance, so it doesn't bear a great cost to the patient, but involve testing basic things about your kidney function, your liver function, your white count, your red count, your bone marrow, uh, whether or not there are any surreptitious viral infections, inflammation markers that might indicate how disturbed your metabolism is with inflammation, clotting factors, pretty much, every basic category we would like to know about so that we can assess and determine and possibly treat problems in the metabolism that, if not treated, may make it harder for us to eradicate the cancer. Secondarily, we like to have a biopsy so we can know what the tissue is. In breast cancer, of course, this is very important because there's receptor status that may dictate treatment if a person is HER2 positive versus if they're triple negative, and this might lead us to another pathway of treatments. And this is an important set of information to obtain. However, there are many people who don't want a biopsy, especially a breast biopsy. There's a growing population of people that are aware that many times a biopsy encounter can be pretty much disastrous, multiple passes in one area to get cores of tissue and cause extreme inflammation. So sometimes we have to set that aside and consider getting systemic imaging instead to see, as I said before, if there's anything of any type of cancer or lesions in area in the body, in the bone, the liver, or other areas besides the primary, say, for example, in the breast or colon, whichever organ is involved. So the testing has to be oriented towards looking at the entire picture. Uh, Furthermore, I like to get some kind of testing as to uh, what the circulating tumor cells and stem cells are doing, and I usually use a liquid biopsy for that. So the combination of basic metabolic evaluation, imaging, yes, maybe some biopsy, maybe not, and then uh, other assessments as far as the cancer metabolism and the circulating tumor cells and stem cells can be very, very helpful. I emphasize this because many, many people say they don't want to have a PET scan. They think it's too much radiation. Well, first of all, no test is perfect, and secondly, no test is entirely benign. And when you get a PET-CT scan, you're being injected with radio-labeled glucose that's going to wash out of your body quickly. Many people say, "Oh, I want an MRI because it doesn't involve radiation." Well, that's true, but then you're going to have gadolinium, and many people have very strong reactions to gadolinium long term. So there are always choices to be made, pros and cons to be weighed, and we like to do whatever we can to get the most information with the least side effects that are unwanted.